for a number of years, and he always strikes me. I hear him in many different contexts and have been in the audience when he's moderated panels and so forth. He really has a genuine ability to not only sound like an expert, really be an expert in such a wide variety of topics. It always impresses me, the work as a journalist, because he really does his research too. So I am delighted to be able to introduce to you our moderator for this panel, Michael McIntyre. He's an award-winning Metro columnist and senior reporter from the Plain Dealer, where he started in 1990 as a general assignment reporter. And since 2010, he's hosted the Sound of Ideas daily public affairs program in 90.3 WCPN Idea Stream, Cleveland's NPR affiliate. In 2016, the Press Club of Cleveland inducted Mike and his wife, Elizabeth McIntyre, who is editor and publisher of Crane's Cleveland Business, into the Cleveland Journalism Hall of Fame. So with that, I will introduce to you Mike McIntyre.
Welcome to this panel about the Cuyahoga River and 50 years since the fire. You guys are all experts on that, right? I guess we'll change gears a little bit. Guys, thank you very much for having me today, and welcome to the discussion. I'm hoping for a lively conversation with lots of expert opinions, and of course, we're going to be welcoming your comments throughout this conversation as well. There'll sort of be a little bit of a Q&A period. We'll get it rolling, and then we'll work it in. There are two microphones in the middle of the room here. So when the mood strikes you, I'll sort of give the call out, and then just start lining up and firing away with some questions. As Dr. Ford mentioned, my name is Mike McIntyre. My job here is to ask questions and solicit thoughts, but there's another reason I'm here, and I wanted to share it with you. I wrote a column in the Plain Dealer about the conversation that I had with a high school senior who really opened my eyes when she said that she was vaping, that half the kids in her school vaped. Actually, she called it juuling because that's a specific kind of vape that they use. She said it was easy to buy Juul pods at gas stations or to get 18-year-olds to buy them for you at a slight markup. That vaping isn't gross like smoking, that actually tastes good. She told me, and this is a quote, "The mint flavor, it feels so fresh, it doesn't feel like you're doing anything wrong because it doesn't taste wrong. It tastes like you're brushing your teeth." She described vaping as an epidemic. And she said that kids do it, the kids she knows, they do it like smokers did back when I was in high school because they want to be cool. And I noted in my column that she was a pretty insightful kid, but I'm biased because she's my daughter. I recently discovered that as a recent high school grad and an 18-year-old, who I don't have total control over, that she's vaping again. It is an epidemic, and it is terrifying. And she's not alone. The U.S. Food and Drug Administration says there's been a startling rise in the use by youth of e-cigarettes. In 2018, the National Youth Tobacco Survey shows a 78% jump in high school use from 11.7% in 2017 to 20.8% in 2018. That translates to millions of young people. So let's talk about what is enticing then to vape, about the impact of vaping, about vaping as an alternative to smoking for cigarette users, and as a gateway to smoking for those enticed by this new method of nicotine delivery. And let's talk about how we can educate them and their parents and help them kick their addictions. To help us do that today, I want to introduce our esteemed panel. Monica Webb-Hooper, Dr. Monica Webb-Hooper is Associate Director of Cancer Disparities Research and Director of the Office of Cancer Disparities Research at the Case Comprehensive Cancer Center in the Case Western Reserve University School of Medicine, where she is also Professor of Oncology, Family Medicine, and Community Health and Psychological Sciences. She's co-chair of the Health Disparities Network with the Society for Research on Nicotine and Tobacco. It's a much longer CV, but it's in your folder, so you can read the rest of it there. This is Monica Webb-Hooper. Also with us today is Mark Christosh. He just graduated from Orange High School, where he founded and led a peer support program that he created to help students kick their addiction to vaping. He started the group after he overcame his own vaping habit. Mark will be attending the University of Toledo in the fall and plans to major in business. Mark Christosh. Dr. Erica Trappel is an associate professor in the Department of Population and Quantitative Health Sciences and associate director of the Prevention Research Center for Healthy Neighborhoods at Case Western Reserve University. Her research focuses on understanding the influence of the physical and social environment on health behaviors to inform interventions and policy that can ultimately reduce chronic disease, particularly around tobacco use. Dr. Erica Trappel. Jessica Vendetti is a licensed professional clinical counselor who currently works for Belfair JCB's Social Advocates for Youth program as a prevention counselor at Orange High School. She spends a lot of time talking with teens about substance use and addiction, sex education, healthy relationships, mindfulness, putting their phones down, and spending more time outdoors. She worked with Mark to form the ABC, or About Control program at Orange High. Jessica. And finally, Dr. Carly Wilbur is a pediatrician with Rainbow Babies and Children's Hospitals. She knows a lot about this topic just from her patient population and the parents she talks to as well. She works in Shaker Heights and Solon, caring for infants, children, adolescents, and young adults. Dr. Carly Wilbur. So this is a conversation, and I mentioned this to some of you. We're going to have to grab a mic, and Mark, why don't you grab one first? And then if, Erica, can you grab the other? And as I'm talking to one person, it doesn't always have to be through the chair, so we'll kind of get it started. But if somebody wants to sort of pipe up and you don't have the mic, just find somebody who's not talking and has one and just grab it and jump in, okay? And I do want to start with Mark, because Mark, I think you're sort of closest to the ground, and many of us are parents and are really interested in the point of view that you bring. You vaped and then you quit. You were telling me this story. We had something in the Plain Dealer and on WBIZ and WCPN as well. What made you pick it up and what made you put it down?
So what made me pick it up was, it was just everybody was doing it, and most people. And so we were in a car, just going to a party, I think, and then one of my friends, they had it, so I tried it. This was sophomore, I think junior year. And for about a year, I was just doing it all the time, every day. And what made me put it down was for a lot of reasons. I went to this camp in summer, and I had like a self-reflection. I looked at myself, and that wasn't who I wanted to be, and it was expensive, and just like I didn't like the feeling where I would have to wake up every morning and use the jewel to just get through the day. You know, I wanted to sort of be my own person and not be controlled by this nicotine.
It was controlling you. I mean, you had to do it.
What was that?
You had to. You felt like you had to do it. You were
right. Yeah, I would be tired if I didn't jewel.
And when you stopped using it, you didn't just stop and say, "Okay, I'm through that." As I understand it, that's when you contacted folks at your school. I see this is Edie Unger Shafran is here as well, and Jessica, and talked to them about what you did and sort of how you might have wanted to help other students. So how did that progress? The idea of wanting to be a support network for others.
So there was one point in the summer where I tried multiple times to quit, but I just wasn't able to do it. I would go 2 days maximum without my jewel, and I really didn't think it was possible. And then I went to the school psychologist, Mrs. Unger Shafran, and she led me through it. She gave me some tools, some steps. And once I saw that I was successful, and I started bringing in some friends to help them, and once we saw the success of our partnership, we got Mrs. Vendetti to join us, and we created the ABC group.
Dr. Wilbur, what do you hear from your patients? Are there many stories like Mark's?
Just like, except for the success part, yeah,
right.
Unfortunately. Not every teenager is that strong, not every teenager is that determined, and not every teenager has the support that he had. So way to go, Mark, because you're definitely going
Mark, you were a sophomore, so Mark was probably about 16 about when this started. Are you hearing from patients who are even younger than that?
I'm always amazed at how honest my patients are with me when I ask about sexual activity or other extracurricular things, and it's fascinating to me. This they don't want to talk about. Yeah, not across the board, but I don't think that they're reporting it accurately. I think that I'm hearing less about it than what the actual incidence is. I think statistically across the country, most teenagers who are polled, like upwards of 60% of teenagers who are polled, admit to having their first vaping experience at 11 or younger.
Wow. Dr. Trappel, this is sort of what you do. You've done the youth risk behavior survey locally in Cuyahoga County. What do those numbers show us?
Yeah, so with our 2018 data from middle school, so this is 7th and 8th graders across Cuyahoga County, we're seeing about 10% of kids telling us that they have vaped in the past 30 days.
This is middle school.
This is 7th and 8th graders, middle school, so 10%. That's about double in our high school. So as of 2017, it was around 17%. We're expecting those numbers to be much higher when we conduct our survey this fall.
Why so?
Well, we've been tracking really with the national trend, and in fact, in some cases, been a little bit ahead of those numbers. We see the national trend rising, and we anticipate seeing that same increase that's happening with the national trend.
This is happening, though, at the same time that you see the actual tobacco use, cigarette smoking, go down.
You are absolutely right.
The number was like 2.5% for cigarette smoking.
Yes. So cigarettes have been consistently low in Cuyahoga County. We have done a phenomenal job coming up with the early work that we did in the early 2000s to really make a clear message that cigarettes are not okay. Where we are continuing to fail now, e-cigarettes and vape is one area, but any of these non-cigarette tobacco products, particularly those that are flavored, are areas where we are really losing against tobacco and nicotine dependence with our kids.
You have, it was sitting on the table here, you have a bag with a bunch of baggies in it, and I don't know how many different kind of vaping products are there, but dozens. You said you collected from a single school?
Yes, so we contacted our partner schools that we work with, and we said, we understand that you are likely confiscating a number of these from kids. We'd love to just see what you're getting. And so actually, 2 of our middle school partners provided us with what they had left at the end of the school year. And so for anyone who would like to see, I have a variety of products, not just Juul, which you may all be familiar with given some of the media, but other products also that are in different shapes that you wouldn't automatically know are nicotine delivery devices.
Dr. Webb-Hooper, we've heard flavors, and we're going to get into that a little more deeply, but flavors being what some people say would be a way to entice young people to try them. As I mentioned, my daughter saying it tastes like you're brushing your teeth when you try the mint kind. To the tobacco companies that are saying the reason we need flavors is because that will help us entice smokers as a cessation device to move off of cigarettes and to move to vaping, which conceivably is better for you, and then eventually to tapering off and not smoking at all. So what about that balance? I suppose you see both sides in what you do. The one side where it's attracting vapors to perhaps eventually smoke, and the other where it's supposed to be used as a cessation device.
Absolutely. So I think the flavors is a tremendous problem, and the FDA is currently under rule and considering ultimately regulation of flavors as they have with tobacco, with the exception of menthol flavor with cigarettes. In my work, I work with adults 18, so some are young adults, up to people who are in their 70s who wish to quit smoking. And of course, one of the major challenges for people who have begun smoking cigarettes is whether vaping can help them become tobacco-free. And what I find in many cases is that they become dual users. And so they're now using both products, using vaping when they can't smoke cigarettes, and so then they're just being exposed to more of the irritants and toxicants. There's definitely a lot of belief that these products are safer, that they actually don't have any negative constituents, and we know that that's not true, that they contain known carcinogens, that they increase respiratory activity in a negative way. They're associated with cardiotoxicity, but there's a belief that this is a safe alternative to tobacco use. And the flavors certainly facilitate, just as menthol cigarettes facilitate the act of smoking and leads people to smoke, inhale more deeply and hold the smoke in their lungs longer by smoking menthol cigarettes. You see a similar pattern with e-cigarettes. It's just that there's so many different flavors and so many different combinations of flavors, and people who are doing it themselves. And these really interesting, if if you will, YouTube videos of do-it-yourselfers creating all of this, hundreds of different flavors of e-cigarettes. So the flavors definitely are a major attracting force.
And the flavors in cigarettes, besides menthol, are illegal. You can't have a tutti frutti cherry flavored cigarette because there's law against that. Would you be in support of that when it comes to vaping products as well, or do you think the argument by the companies that put them out is that we need those flavors to entice those smokers to stop smoking?
Okay, so this is kind of tough, because I think that in the United States, we kind of view e-cigarettes still a bit more cautiously, and we're not as, compared to, for example, the UK, where they're much more supportive of e-cigarettes in terms of harm reduction. I think most tobacco control researchers and practitioners are still kind of against it. I've moved, I know, in my thinking about it, where I was staunchly against it at first, and now it kind of depends. I think that the flavors are a problem, and we should definitely be making sure that they're not marketed to youth, because we know that that does become, I mean, there's evidence suggesting that they are becoming a gateway, and that kids who are assessed at time point 1, who are vaping at time point 2, they become more willing to consider cigarette smoking and are more likely to actually report cigarette use. So it does seem like it's moving them on the trajectory to not only becoming nicotine addicts, but eventually combustible cigarettes as well. So for youth, I'm totally in support of full regulation. As it relates to adults and current smokers, you know, I struggle with this quite a bit in my work in treating tobacco users. And when they ask that question, you know, if they're willing to make, you know, an exclusive switch and not be using both products, then I would say vaping is certainly less dangerous for them, although it does contain some irritants and carcinogens. But if they're going to be using both, then I would like them to try to become nicotine-free. And that's, you know, we talk about tobacco cessation, but, you know, now we talk a lot about tobacco and nicotine cessation.
Jessica, you've seen the ads, the Juul ads. Mark, can you give Jessica the microphone? You see these Juul ads in which the first thing it says is, not for people under 18, not for children. So they've set the groundwork. This is an ad for the population that Dr. Cooper was just talking about, people that want to quit smoking. And yet, people who see that, I guess I want your opinion on who's watching that and who it's working on.
I don't know that the commercials that all of us see are necessarily what our youth sees. The way that our youth consumes media is very different than most adults. And I've heard from a lot of students that one of the reasons it gains popularity, whether it be the Juul or other devices, is there are folks on social media, Instagram and Snapchat, showing off with their vapes.
Smoke rings.
Exactly, and vaping competitions, you know, how fast can you do it? How big of a puff of vapor can you make when you exhale? I think that the issue is these companies have found a way to make their products very usable for teens. So, you know, if they can get a teen to try it, it's easy for them to continue doing it. When we were all younger, if someone was smoking cigarettes, your parents had an easier time catching you. You were going to smell like cigarettes walking in the door on Saturday night. If you were smoking in the bathroom at school, someone was going to smell the smoke in the bathroom. And, you know, one of the biggest things about vaping is how invisible it can be. So by the time a student is addicted to the point where they are taking the risk of getting caught at school by vaping in class or in the bathrooms, or they are using it so heavily that their parents have become aware of it, they're usually very far down the path of addiction, as opposed to with traditional combustible cigarettes. I think oftentimes, you know, maybe people were aware of it sooner. So I think that's one of the big differences.
One of the things along the lines of vaping in the bathroom, at the graduation at Rocky River High School this year, the principal made a joke in which he said some of the students came out of the bathroom and said, "Who put toilets in the vape room?" Basically acknowledging the fact that that's what the kids there see that room as the purpose for that room. That becomes sort of the attitude throughout the young people, and you talk to them all the time. do they want to quit, or are they all just talking about this is what we do when we go into the vape room and this is our lifestyle?
There's many students who want to quit, but feel helpless and hopeless, that they're not able to quit. When we work with a student, Ms. Underchaperon or I, privately, or we're working, having a conversation within our ABC group around helping someone make a plan, one of the things we talk about is how are you going to manage the trigger of walking into the bathroom at school. One of the things we recommend is you can always go to the nurse's bathroom, and the nurse is happy for you to come and use her bathroom instead. Go to the bathroom right next to the principal's office. That's not the one students use if they're going to choose to vape. I think the biggest thing that helps me know that there are kids who want to quit that are struggling to do so is that when I have kids like Mark who have successfully stopped using, when I talk with them in supporting them to maintain that sobriety from nicotine, and I ask about how are you dealing with parties when you're in social settings? Are you struggling when friends are offering the product to you? Students will tell me they are proud of me, they wish that they could do it, they are not pressuring me. So I think occasionally you might have a kid saying, oh, why aren't you doing this? Come on, hit it. But oftentimes you have young people who are still addicted. They're very proud of the folks who've been able to stop. So I do think that they are struggling with a true, real addiction that is out of control.
So the best way to stop, did you want to jump in?
Actually,
Please do.
just because what you were saying reminds me, and also what Mark was sharing, is that nicotine is a highly, highly, highly addictive substance. It's more addictive than any other drugs. You have more acetylcholine nicotine receptors in your brain than you for any other drug. And in the cigarette literature, we know that it only takes 3 exposures, so 3 cigarettes before nicotine dependence begins to develop. So what we're creating is the next generation of nicotine addicts who behave much like smokers, although the product that they're using may be a bit safer in terms of the long-term health outcomes, which we still don't know what the long-term health outcomes will be. But also what Mark shared was nicotine withdrawal. So when he's talking about how he feels tired and how he feels like he has to do this to get through the day, that's what cigarette smokers experience as well. So you have students who are functioning in a state of nicotine withdrawal where they must continue to expose themselves to vaping, otherwise they will experience all of the symptoms of nicotine withdrawal. So we certainly are creating the next generation of nicotine addicts.
And I think specifically with the addictive nature of the Juul, with teenagers, we need to keep in mind 2 things. Juul is nicotine salt, so Juul's figured out a way to make nicotine even more addictive. It has a high concentration of nicotine, and we're dealing with teenage brains, which are much more susceptible to addiction than adult brains. And adult brains don't show up until between 23 and 25, depending on gender. So when we have an 11, a 12, a 13-year-old who is exposing them to an extremely addictive product, the risk of addiction after those 2, 3, 4 exposures to nicotine is just incredibly high.
I think probably ideally is to have somebody not start something rather than have to try to get them to not continue using it. And I want to get maybe all of your thoughts on this. Jessica, we were talking about this just a little bit before the forum. When you're talking to high school students, you might be too late. And even as we heard from Erica, we might be too late talking to middle school students as well. You're talking to kids even younger than that, or at least did in this one classroom. What do you think about the strategy? How early do we have to start talking about nicotine addiction and about vaping and about not doing it?
I think we need to, as educators and health providers, start making this part of the conversation throughout the lifespan. Speaking in an appropriate way about it in our elementary schools, and empowering and educating parents to speak to their children when they're younger. So helping to give parents the language of how do you have a conversation with this with your 7-year-old, and then what's that conversation look like? How is it different with your 10-year-old? And really getting those conversations going early and often, and just making it part of the language and the discussion. I mean, most elementary students can tell you that alcohol is dangerous and cigarettes are bad. So they're already aware of these things. They already have a frame of reference. So just helping them to understand that vaping also fits in that category. And I see elementary students being very willing and open to this education.
Dr. Wilbur, you want to get your thoughts on that?
Well, I wanted to add to what you were saying. I was at a similar event in Hudson, and we were talking about what to do. That the police officer who patrols the school in the high school was telling me that he also is in charge of Safety Town for the rising kindergartners. And is that too young to talk to them? And I said, nope, because the parents don't know what these devices look like. Tell the kids, because they're in their siblings' stuff. And so they'll find it and they'll take it to their parents. Because the population you're working with, thank God, you and your cohorts are the kind of kids that have that kind of mature introspection about who you want to be in a 10-year plan. Somehow, the kids that I'm talking to are, when they say that the symptoms of nicotine withdrawal that you were talking about, that they're sleepy or they can't concentrate, they say vaping makes them feel better. Without it, they don't feel it. And the conclusion that they reach is that the vaping must be good for them.
So, kindergarten, we
Yeah,
need to start talking about that. And
Well, just making them aware these are dangerous things. If you see that in your sister's room, you just go tell them. Hey, don't do it.
we need a nation of narcs is what we need.
Yes. Well, because the teenagers, you're a diamond in the rough, Mark. You know, the teenagers aren't necessarily turning themselves in, and they feel so age-appropriately invincible that they're just not getting how dangerous this is.
It would stand to reason too, you can pass it, but it would stand to reason too that that's the same age of kids that always tell me to put my seatbelt on when I get in the car. They're the same kids that would, they're the same kids that would say, that would probably look down on somebody smoking and saying, why do they do that? That's bad for them. Why not at that age they should know about vaping?
My children, when we pass someone on a motorcycle without a helmet, they go, look, Mommy, an organ donor. 'Cause that's what I've taught them.
Brutal.
Yeah.
But true, absolutely true.
And I wanted to add, I think the comment of starting early is really in having a conversation about the healthy choice, or the things that are good for their bodies and what you put into your body. Because inevitably, in the next 3 to 5 years, there's going to be the next version of the Juul, right? 10 years ago, there was something before the Juul and before the electronic cigarette. And for some of us, for me in particular, that was flavored cigars, and that's what we were talking about back then. The industry is always going to find the next thing. And so as, advice for parents, I think about my own children. I need to think more broadly and not just show them this one device or be aware about this one device, because they'll say, oh, Mommy talked about this one device, so this one must be okay, right? And in this rule-following way, I think that's what we're seeing play out. Even in the market, as you said, juuling, right? This word has been turned into a verb, so that it is now different and other than the things that we might be talking about, and that there's a lot of intention in semantics.
If you ask a child, do you Juul? And they'll say, no, I dab.
Right.
There's a, yep, the semantics.
And they would never say e-cigarette,
Yeah.
which is something that, you see all the studies say that's not even a thing. So maybe learn the language. But let's go down this line though. What else can people who are parents and people who are uncles and aunts and friends, how can we get the message across? I know a lot of times I will say, well, look, here's the research. As you said, long-term studies aren't yet in, but it doesn't say it's safe. Here are some things that you do. I pulled out the story on popcorn lung. That sounded really gross. So here's a thing. But I would throw anything at them. How do we get to the point where we're giving them real information and stuff that's actionable and that'll actually work? So a thought from you, and then maybe Mark, what can adults tell your cohorts? Dr. Hooper first, yeah? Okay.
Well, just a thought, because, how schools will have opportunities for parents to come in and talk about their careers. So this year I went into my daughter's kindergarten class, and I talked about my career as a psychologist and tobacco researcher. And in talking with the kids, I had that same question: How am I going to make this understandable for kindergartners? And I, asked them, of course, do they know anyone who smokes? Have they ever seen anyone smoking? And of course, most all of them, if not all of them, had. And I talked about, did anyone know what smoking does to you? And there's always at least one kid in the class who knows smoking causes cancer. My grandmother had cancer, and then it started the conversation about the health effects. And I wasn't sure, so we went down that line, and I wasn't sure how effective it was. And then a few weeks later, one of my neighbors, who has a daughter in the class, shared that they had recently returned from a trip to Paris. And in France, you know, smoking is everywhere, and they were talking about just how